Hello and hi to Miss Wan Farah. Our group will presenting our pamphlet in the topic eating disorder. So this is our group member, which is me, Alif, Nisrin, Alia, Ame Andika, Sarina, Ayuni, Shazwani, and Frizana. So this is our pamphlet. The overview of eating disorder. Eating disorder are serious mental health conditions that can have a profound impact on physical health and well-being. And then they are not just afraid about food, but they are often reflect by underlying emotional and psychological struggles in their life. For the causes and risk factors, I will pass to the next person.
For the causes and risk factor, we have three. First is genetic factors, family history and its role. This refers to the influence of inherited traits from one's family, which can contribute to certain condition or predisposition. Understanding the health history of your family helps identify potential genetic risks. And second is biological factors.
Biological factor is imbalance in neurotransmitter. Okay. An imbalance in neurotransmitters such as serotonin, dopamine, and norepinephrine is linked to eating disorder. For example, low serotonin level may contribute to feeling of anxiety or depression, potentially leading to disorder eating pattern. Dopamine and norepinephrine imbalance can impact reward and pleasure response, influencing an individual relationship with food.
For the psychological factors, we have low self-esteem. This indicates a person's negative perception of oneself, which can impact mental and emotional well-being. Low self-esteem may contribute to various health issues and influence behavior and decision making. And next is symptoms of eating disorder.
Symptoms part of eating disorder, the first one of the symptom is anorexia nervosa. What is anorexia nervosa? These symptoms are intense fear of gaining weight. The person who have this eating disorder and have these symptoms, they are afraid that their body weight are increased and it will increase their anxiety about the insecurity with their body image um, that can make them to people give them with um, negative judgment to them, especially with our body. So the next point I will give to the one Nurul Ayuni.
Okay, so the second symptom of eating disorder, bulimia nervosa. It's like excessive concern about body weight and shapes. Bulimia nervosa is like involved episode of eating a lot of food in a short time, and also feeling out of control during these episodes. Afterward, the individual might try to prevent of gaining weight by they try to vomit back the foods, and then they try excessive exercise, and then they even try to fasting. Um, Also, people with bulimia often worry about their weight and also appearance, obviously. Some example that I could give is like imagine someone with bulimia nervosa. When they feel stressed and then they start to eating a large amount of ice creams, and then uh they start to eating a lot of ice cream in short periods, and then during this stage they feel like loss of control. And then suddenly they thought of like, am I eating so much? And then they're afraid of their gaining weight. and then they start to like, basically that I just say, they start to vomit their back the foods. And then the last symptom, binge eating disorder, consuming a large amount of food rapidly, often accompanied by a sense of loose control during these episodes. Unlike bulimia, individuals with this disorder typically do not engage in behavior like vomiting. They are different from the bulimia. Bulimia is like you're vomiting back the food and then you stop the control. But for binge eating disorders, like you constantly eating the foods without the control. And then example for it is also when they are feeling stressed and then they find themselves like eating a whole bag of chips, and then like they eating it like non-stop. But even though they are eating it non-stop, they doesn't care about their appearance like the bulimia. And then what I can conclude for the symptom is like two symptoms, like both disorders can have serious physical and mental health implication. And then if you know or someone they are struggling with this, you can consider seeking a professional help. That's all for me. I pass to the next person.
Now, for diagnosis, a psychiatrist or psychologist will assess symptoms, medical history, and conduct physical examinations. Laboratory tests may also be used to identify any physical complications. Now, towards treatment options for Wani.
So for the treatment option, the best treatment for eating disorder involves a team approach. The team commonly includes a primary health care provider, a mental health professional, and it can also be a registered dietitian. The treatment depends on the specific types of eating disorder, but in general, it includes learning about proper nutrition and learning how to develop healthy eating habits, and also behavioral therapy, also called as talk therapy. Behavioral therapy, such as family-based treatment (FBT), is an outpatient treatment for children and teenagers with anorexia. It also is likely effective for bulimia and other problem eating behaviors. The family is involved in making sure that the child or other family members follows healthy eating patterns and maintain a healthy weight. Other than that, CBT, cognitive behavioral therapy, is commonly used in eating disorder treatment, especially for bulimia, binge eating disorder, and some other problem eating behaviors. The types of CBT co-enhanced CBT is used most often. Is where you learn how to monitor and improve your eating habits and moods, develop problem-solving skill, and explore healthy ways to cope with stressful situations.
So now on to coping strategies. People with eating disorders may have negative thoughts about themselves and the world around them, and these thoughts can make their symptoms worse. So one of the coping strategies is to find a healthy way to express themselves. So expressive arts usually includes journaling, drawing, or other creative outlets. When they express their emotions, they can cope with different experiences. Now I'll pass it on to Serena.
The next is family and friends, where they play an important role in open communication and understanding. Having a network of family and friends who are supportive can be very important in when managing an eating issue. Their support in healing process can be offer psychological stability and strengthen in constructive actions. In order to create supportive environment, loved ones empathy and open communications is very necessary. For a speed recovery, it is frequently advised to have a professional assistance in addition to support.
Alright, everyone is done. Thumbs up if done. So that's all from our group. Thank you.